Good afternoon, everyone, and welcome, if virtually, to the Rockefeller Institute of Government. I'm Leigh Wedenoja, Chief Economist at the Institute, and I will be moderating today's webinar, Reducing Administrative Burden in Public Health, in honor of National Public Health Week. This webinar is hosted in collaboration with the University at Albany's School of Public Health and was organized by UAlbany professor and current Rockefeller Institute Nathan Fellow, Jennifer Manganello. I'd like to thank Dr. Manganello and her fellow panelists, Dr. Ashley Fox and Eric Pasternak, for being here today. I want to kick it off with a little bit of housekeeping before I jump into the substance of the webinar. This webinar will be recorded and available on the Institute's YouTube channel and website for anyone who's unable to attend live. Our three speakers will be followed by a shared Q&A. If you have any questions, please ask them in the chat tool in Zoom, and we will follow up with them live. There are many government programs and services that play a critical role in supporting the health of Americans. These programs include traditional healthcare supports like Medicaid, public child health insurance programs, and funding for vaccines, but can also include programs that broadly support public health, like the Supplemental Nutrition Assistance Program, also called SNAP, services for people with developmental disabilities, and health education campaigns. While these programs provide essential benefits that have repeatedly been shown to improve the health of families that receive them, they still do not reach all the families that are eligible for services. The USDA estimates that only 82% of households that are eligible for SNAP actually receive those benefits, and 11 states have take-up rates under or at 75%. And that's for a commonly understood program, SNAP, which many of you may know as food stamps. With a relatively high application take-up, a very straightforward application. Programs that target smaller populations, including people with disabilities, may have even lower levels of take-up. We found that in our four-part series, Navigating the Benefits Cliff, that there was substantial difficulty in navigating benefits among this population in particular, due to complex rules and substantial misinformation that live in the systems that people who apply for these benefits inhabit. Today, we're going to hear from three experts on the topic of administrative burden in public health, including what administrative burden is, how it can be overcome, and focusing specifically on people with developmental disabilities. I would now like to welcome our first panelist, Dr. Ashley Fox. Dr. Fox is an associate professor of health policy at the Rockefeller College of Public Affairs and Policy at UAlbany. Her research focuses on health politics and policy, with a specific focus on how state policies contribute to the generation of administrative burden. So I will turn it over to you.
Wonderful. Thank you so much. And good afternoon, everyone. It's my pleasure to be here and to present on such an important topic. Much of my current research focuses on this question of how administrative burdens, particularly in social safety nets, affect program performance, as well as uptake of benefits and inequities in access to benefits. So I will give a very brief overview of some of the key concepts of this growing field and this growing literature, which actually comes out of the field of public administration, and its potential applications to the field of public health, both of which fields I sort of straddle in my work. So I just have a little bit of background about what is administrative burden. What does this concept even mean? So one definition of administrative burden is an individual's experience of policy implementation as onerous. Interestingly or ironically, this definition was actually come up with by someone whose last name happens to be Burden. But, some examples of administrative burden that we've all probably experienced in our own lives include things like, the process of renewing your driver's license and the interactions that we might have with people at the DMV, the process of registering to vote. By the way, don't forget that today is primary day in New York State, and hopefully you already registered to vote, so you have the ability to go and do that. Although if you didn't register for a particular party in New York State, you wouldn't be able to vote in that party's election. So again, that's sort of an example of what might be an additional burden that you might need to know about in order to properly register to vote and actually vote in an election. Another example might be something like vaccine mandates or exemptions from vaccine mandates. So we all just went through the pandemic, and if we were at a university, many of us had to produce proof of vaccination. How easy or hard it was to prove that you were vaccinated, again, could be an example of burden. And also how easy, if you were someone who maybe didn't want to get vaccinated, or hard it was to get an exemption from that mandate, could be another example. More generally, people often think about administrative burdens as the process of accessing different types of government benefits. So another example might actually be the FAFSA application debacle that we're all encountering right now that's really impacting higher education. But I think a more lay definition, or the way that I like to think about administrative burden, is essentially, if you make something easy for people, they will be more likely to do it. And if you make it hard for people, they will be less likely to do it, right? It sounds pretty basic. And I'm sure we've all experienced this at some point. For instance, maybe you ask yourself, is it even worth it to submit all the paperwork that would be required to get reimbursed for a small expense that you encounter, like parking or something? Generally speaking, when we think about administrative burden, we're thinking about it in terms of the public sector, but private sector also has administrative burdens that they might impose on customers. For instance, if there's something that they don't want customers to do, for instance, managed care organizations might require prior authorization for certain medical procedures to make it harder for you to get them if they're costly. Or for instance, a gym might make it really easy for you to sign up, but it might make it really hard for you to cancel, right? And so many of these are actually quite intentional and are based on some pretty basic insights about the way that people behave, and what we can predict about how they will respond to different stimuli. So another distinction that may be useful to think about is this distinction between administrative burden and the related concept of red tape. So red tape has classically been conceptualized as the rules and procedures that hamstring bureaucrats as opposed to citizens. So for instance, more rules that place burdens on government workers. Likewise, red tape is often thought of as rules that serve no legitimate purpose. By contrast, administrative burden, first of all, it applies more to citizens, but also it applies to rules that do potentially serve a legitimate purpose. For instance, in the context of accessing safety net programs, ensuring that only the most needy people get benefits, or efforts to try to prevent fraud from occurring. However, the problem with burdens is that even if their purpose is legitimate, they may inadvertently, or maybe even advertently, prevent people that they are trying to serve from actually getting the benefits. So another way to think about this is in terms of type 1 and type 2 error. So you've probably all encountered, if you ever took a basic intro stats class, you may have learned about type 1 and type 2 error. Maybe you're having flashbacks now to a stats class that you don't quite want to remember. But basically, as a refresher, type 1 error refers to false positives. And in the context of, say, accessing safety net programs, this might refer to accidentally giving benefits to people who are not actually eligible. So this may occur, for instance, due to mistakes about whether someone qualifies, or just due to outright fraud, right? People trying to claim benefits who are not actually eligible. On the other hand, we have type 2 error, or false negatives. So this involves accidentally excluding people who are otherwise eligible, again, perhaps because the rules are actually too complex or too stringent. So when it comes to safety nets, the way that we have, at least in recent history, set up the rule architecture is often in a way that emphasizes deterring type 1 error. So in other words, trying to prevent fraud or keep people off benefits who don't qualify. But for instance, one thing that I have argued in my own work is that by emphasizing type 1 error, we actually produce type 2 error. In other words, when we make claiming benefits really difficult to prevent fraud, we may increase the number of people that we inadvertently exclude. And concerningly, those who we exclude may be among the most vulnerable. So just a little bit more kind of background on some of the literature about administrative burden. So Hurd and Moynihan are two very prominent researchers that have researched this concept. And one thing that they argue is that while, things like little administrative details, like the length of an application or whether people can apply by phone or online or in person, these may seem like really minor technocratic decisions, but Hurd and Moynihan argue that these have really consequential impacts, even for these seemingly minor decision points. So first of all, they note that burdens are costly in that they place hidden costs to claiming benefits on citizens, right? And I mean, this may be in terms of money, but also just in terms of time and energy. So when they talk about costs, they're talking about, this sort of broader notion of costs that would encompass things like people's time and cognitive energy. They also argue that burdens are constructed, meaning that rules are the product of deliberate choices by decision makers in a position of authority. And since burdens are often generated in the process of policy implementation, as opposed to during a legislative process, Hurd and Moynihan have referred to this as policy making by other means, meaning that even if politicians can't, say, find a way to ration welfare legislatively, they can still do so through the implementation process, right? Because these are things that often happen in the process of implementing a policy. So in this sense, they argue that burdens are highly consequential in that they, can really determine who gets what, where, why, when, and how, right? Who actually gets the benefits. And often these can fall more heavily on those who are the least able to advocate for themselves. And so in this sense, the burdens are also distributive, what they refer to as distributive, in that the most vulnerable tend to more systematically face these burdens and are more systematically excluded. So I would also add to that that burdens are unpopular by making interactions with government onerous. They tend to erode support for and trust in government, and basically give the general perception that government is, inefficient or onerous or something that people don't want to encounter. So just to elaborate a little bit more on some other concepts from Hurd and Moynihan's work that is often cited, Hurd and Moynihan also talk about the ways in which administrative burdens can negatively affect health by blocking people from accessing health-promoting social welfare programs, such as food assistance and income supports, and also produce potentially direct health impacts via psychological and stress mechanisms that come from having to navigate very burdensome bureaucracies. So specifically, Hurd and Moynihan identify three types of costs that administrative burdens impose upon citizens and potential claimants. These include learning costs, compliance costs, and psychological costs. So briefly, learning costs refer to the costs that claimants face in learning about a program's existence and benefits. For instance, how do you even know if you're eligible for Medicaid or not? How do you come to find that out? Compliance costs refer to filling out forms and documenting whether you continue to be eligible, or may, for instance, for a program like unemployment insurance, you may have to engage in job searches and prove that you're looking for work. And finally, psychological costs refer to the sort of stigma and anxiety associated with accessing benefits, especially when it comes to things like safety net programs that are often considered to be, government handouts that have a lot of stigma associated with them. So in the interest of time, I will maybe not go into this in detail, but I just want to point out that, there's a lot of connections between the literature on behavioral economics and different sort of cognitive biases that contribute to people having difficulty engaging with these very burdensome rules. So things like cognitive ease and fluency, procrastination, ego depletion, all of these can help explain why we might experience these burdens as particularly onerous. So I just want to sort of conclude with highlighting a few recent examples of burdens, and the fact that this is finally getting much needed policy attention. So just some examples from, the pandemic. During the pandemic, specifically pertaining to Medicaid, there was the continuous coverage requirement, so also known as the maintenance of effort requirement. So basically, during the entire pandemic, or nobody had to actually reapply. And so it turns out that reapplication process, having to reprove your eligibility, kicks a lot of people off, often even just because they forget to file their paperwork, right? And so there's been a significant reduction in churn during the pandemic, what's known as churn, so people going on and off Medicaid as a result of this. And during the unwinding process that is still occurring, states that have used things like ex parte renewals to try to use administrative information about like income or other program participation have done a much better job, keeping people on Medicaid who otherwise might have lost coverage due to not returning forms, for instance. And more generally, outside of the pandemic, many states have implemented 12-month continuous eligibility for different groups like children, in order so they don't have to reapply, say, every 6 months. They're continuously covered for the whole year, or implementing things like presumptive eligibility in order to presume that you're eligible even before you go through the whole application process. And so recently, President Biden signed an executive order on transforming federal customer experience and service delivery to rebuild trust in government. The goal of this is to reduce administrative burden in government, and as the title suggests, thereby hopefully to rebuild trust in government. So instead of seeing government as this really sort of onerous and burdensome entity to interact with, hopefully to make our experience of government a little bit easier. So with that overview in mind, I will turn it back over to Leigh.
Thank you so much, Dr. Fox. I'd now like to welcome Jennifer Manganello. Dr. Manganello is one of this year's Richard P. Nathan Fellows here at the Institute, which has been a delight, and a professor and associate dean in the School of Public Health at Albany. Her work focuses on health communication and the effects of media and technology on health attitudes, knowledge, and behaviors. Welcome.
Thank you so much, Leigh, and thank you, Dr. Fox, for that introduction to administrative burden. So just really quickly, I wanted to introduce the fact that my fellowship this year focuses on how we can use some health communication strategies to address administrative burden in public health, with a specific focus on helping families and caregivers and people with developmental disabilities. The reason that I'm focusing on that in part is because of my expertise in health communication and health literacy, but also because my older son has multiple disabilities, and we have had to navigate through multiple systems to get services for him over the years, including OPWDD, which is New York's version of services for people with developmental disabilities. So I'm really excited to be here today to talk about this and to help people think about some of the ways that we can use health communication to address administrative burden. So Dr. Fox had just shown you this diagram. And so as we go through what I'm talking about, I just want to emphasize that, as we think about these different costs, think about these things as I'm talking about some of these health communication ideas and how we can apply those to reducing these learning costs, compliance costs, and even psychological costs of accessing different programs and services. To add a framework to my discussion, I'm going to be introducing this idea of the ecological model to you. It's something that we use a lot in public health. And for those of you who aren't familiar with it, I'm just going to give you an extremely quick overview of it. The idea here is that there are different spheres or levels of influence on people's health. It also helps us think about the ways that we can structure different programs or interventions to improve health and health outcomes. And so there are really these kind of concentric circles where the levels get broader as we go. And I'll be talking about each of these over the next few minutes. So we're going to start with the individual level. And really here, when we think about the individual level of the model, we're thinking about individual people's knowledge, attitudes, and behaviors. And so right off the bat, when we're thinking about administrative burden and different kinds of costs, we want to be thinking about what are the materials that we can create to educate people about these programs, and how can we use different styles of communication, different formats of communication to provide this information to people. This even goes down to the basic level of thinking about what is the reading level of these materials? What are the images used? Do we have enough white space? There are all kinds of recommendations and resources for how to use communication practices to effectively design materials for people that I don't have the time to go into here, but you can find a lot of these resources online. We can also think about ways that we can use technology, whether they're phone apps or a lot of more work being done more recently around artificial intelligence. How can we use these different technologies to improve access to systems and services for people? So that, again, we can think about how are we reducing the burden that they have to deal with. And then I also want to invite people to think about different programs we can implement around building different types of literacies. There are all these different literacies that come into play when we have to access these different services, including things like insurance literacy and digital health literacy. Do we know how to access the app? Do we know how to use the website and find what we need? So there's a lot we can do on the individual level to think about how we can improve individual skills so that they can better access the materials and information that they need. But what's important to recognize is that we don't want the burden to be fully on individuals. And so this alone is not the only solution. And that's why we want to expand beyond the individual sphere to think about other levels that we can intervene on as we consider ways to address the burden. So the next level up is the interpersonal level or the network level. And there are actually a lot of things that we can do here as well. So one of the ways that people really the things that people rely on a lot when they're thinking about these services and learning about what kinds of services are available, how to access them, really comes from their social networks. And this can include family and friends, but also healthcare providers, people that they know in schools like teachers and more. So I can tell you from personal experience that family and friends played a huge role in terms of helping me. And these were people who, I would be in conversation with, and they would tell me, oh, well, have you looked into this service? Or it's really important that you find out about this particular service. And without those people in my life or in communicating to me about these services, there's a lot of things that I wouldn't have known to do. There are a lot of support groups out there for people with all different kinds of health conditions or disabilities, for parents and more. So how can we utilize support groups to help reduce administrative burden? And then there's a lot of peer navigator type programs out there. And some of these have been shown to be really successful in helping people work through these different systems and even things like application processes. We've seen that a lot here in New York State with our, state health insurance plans, that when we have these insurance navigators, they can be really effective. How can we use those for some of the other services that we provide, such as developmental disability services? I think that's important to think about. Social media, we hear a lot about, right? And we hear a lot of negative things. We hear a lot about misinformation, and all of those things are really important. But social media can play a really positive role in this as well. Again, I first learned about the services through OPWDD through some random parent that I don't even know posted something about services they were getting in New York State on Facebook. And I was like, what are they talking about? So I asked them, and that was really what started my experience with that system. There's a lot of groups on Facebook, for instance, where people try to get information, where can I go for help with this problem? How do I get in touch with this office? Things like that. How can we build on these things to encourage more positive communication and help people learn about the things they need to do through social media? And finally, I want to mention provider education and training. This is not just about healthcare providers, but also things like childcare providers, for instance, insurance providers. Referrals to services is a big issue. I have seen so many different doctors with my son, and not one of our clinicians ever told us about OPWDD, for instance. So to me, that's a really important intervention point. And we want to think about how can we help educate people about these different services And do we have materials we can give them, like an information sheet or a brochure that they can give to parents to help get them started? We're using a lot more things like QR codes on these materials so that parents can just scan that, or families, or individuals can scan the code and it brings up the website they need to go to. These are all really great strategies. We can also think about communication styles. I do a lot of training for public health professionals and healthcare providers around shared decision-making, teach back, and more. There's so many different strategies we can use when we're talking with people to improve how we communicate about these different systems. Then from the organizational level, we can think about things like the clarity of eligibility criteria, the application process, the complexity of the forms and paperwork. I cannot tell you how often I get forms in the mail that I do not know what I'm supposed to do with them. And again, staff education and training. I do a lot of trainings for local health departments, for instance, where I talk about health literacy, cultural competency, best practices for designing materials and websites. These are all great health communication related practices that staff don't necessarily learn in education or when they're hired into a role. So how can we provide that education to staff so that they can implement these practices in the work that they're doing and the materials that they're creating? And then this is a great resource. It's specific to creating health literate organizations, but we can use these things to apply to all kinds of administrative burdens in public health. So I encourage you to take a look at this document. And then clearly we have policies as well. Dr. Fox just mentioned this burden reduction initiative that you see at the bottom here, going through the Office of Management and Budget at the White House. We also have the Plain Writing Act of 2010 that was implemented around clear communication and the need to use plain language. And then even things like referrals. We have laws here in New York that require providers in early intervention to make a referral to OPWDD. That can really take a burden off of individuals to figure out the eligibility process if we have a system in place where they are being referred through another agency that they're already involved with, so that they don't have to do all of the legwork themselves, like I did trying to figure out what services are available and how to access them. So in the last few minutes that I have, I want to quickly go through some website examples because I think it shows you a little bit more, from a more practical perspective, what I'm talking about in terms of the differences that we can make here. So there's a really great guide online called Health Literacy Online, and it really talks about ways that we can simplify the user experience. And there's some really great tips here, and I'm not going to go through them in detail. I've summarized them here, but they're things that make a lot of sense. Writing content that tells people what do they have to do. Sometimes we actually don't do that. And so then people don't know what it is they actually need to do to access the service. Making sure things are easy to find on a web page, organizing the content, making navigation easy, engaging users, and most importantly, and this is something I say no matter what you're doing with health communication, is testing out what it is that you're doing. So you want to try to test out your website, your materials, et cetera, on groups or people that may have literacy challenges or cognitive challenges to make sure that things are able to be easily understood and accessed by everybody, and make sure everything is accessible as well. So I want to show you a few examples in terms of websites that are out there for learning about services for people with developmental disabilities, just to show you what this looks like in the real world. So I don't want to call out any states because we all know that everyone works really hard in doing what they do, and we're all limited by different resources that we might have. I'm just using these to kind of show you some examples of where we might be able to improve things or change things as we're designing information when we think about how we can use better practices related to health communication. So this is one state, and you can see here, this is the main page for their developmental disabilities office. And if I'm come here as a family member or a person with a disability, I'm not quite sure where I need to go from here. There's some really great information, but you'll see down on the left, this is really the main link that I need to go figure out if I'm eligible or not, but I'm not sure that I'm going to know to go there when I first get to this page. And if I click on that link, it brings me to this page, which is great because it tells you what you need to submit to try to get services, But again, it's a little bit hard for me to figure out, do I have to click on all of these things? Do I have to fill out all of these forms? Where exactly do I send them? What am I supposed to do? So, so those are just some things to think about. But what's great here at the top is we do see the different language tabs, which is really great in terms of language access, which is, again, really critical for communication. This is a second state, and I'm going to show you down here. This is really great. You see a button that you can click on. Are you interested in services? Start here. That's great. I know exactly where to go and what to click on. When I get here, I really like this because it shows me different services that are available based on the age of the person who's interested in services, which I think is great. The thing that's a little tricky here, though, is I'm not sure what all of these different programs are or how I know if they would apply to me or not. So that's going to require a lot of clicking around and trying to figure out exactly where I need to go. So that's a little bit more challenging. Here's a third state, and again, you get to their landing page, you see some nice bright images and some clear headings for where you want to go. And you can see over to the upper right, it says apply for DDS services. And so that is where I would probably click if I was coming here. And when you get there, you have these nice two big buttons, apply for services or learn more about the eligibility process. So that makes it really easy for me to know, okay, well, I'm not sure if we're even eligible, so let me click on that. And then once I click there, it actually has a really clear list here about whether people or not would be eligible for services. So I can really clearly see here, would I be eligible? Would my child be eligible, et cetera. So this is definitely an improvement in terms of navigating through that initial phase of trying to find out how you would, whether you qualify for the services. So in conclusion, I'm going to go to New York State because that is where we are. And so when I get to the page here for New York, we see a tab all the way to the left, access support. So I think, okay, that's where I'm going to click, although there's other places that I might want to click as well, such as types of services. What I love here is when I click on access supports, I get, instead of getting a page with a lot of text and small font and not knowing where to go, I get this nice colorful page that says get started. So I know I click there because I want to get started. That then brings me to the next page, which is the front door. And so New York has done this really creative thing, which you're going to hear about more next, that they have this terminology they use called the front door. And I really like that because then it's like you're going through the front door to access the system and the services. So it gives you this kind of user-friendly way of thinking about getting in there. And I'm going to click enter here to get into the front door. And when I do that, I get this nice screen with a fairly big font, and then these great tabs over to the left. How do I begin? And what are the key components? Access to the booklet. So I know I can click on these things to get more information. And to wrap up, I just want to point out that there's a link here to view the front door video modules. And that is what you are going to hear about next. So thank you.
Thank you so much, Dr. Manganello. I'd like to welcome finally our final speaker, Eric Pasternak, the Director of Service Access for the New York State Office for People with Developmental Disabilities. He's also the coordinator of OPWDD's Front Door program, which provides people with disabilities and their families access to services from initial contract through eligibility determination, authorization, and service delivery. Welcome.
All right, thank you both, and Jennifer, that was a terrific setup. Thanks for demonstrating all of that. It was nice to see what's also going on in other states and their websites and accessibility goes. So thank you for that. And hello, everyone. So yes, among other things I'm responsible for at OPWDD is I'm a statewide coordinator of our front door. And what that really is, what the front door is and intended to be, is a standardized experience for folks that are interested in accessing OPWD services wherever they live in the state. So from the point of initial contact with us, to us getting them connected with a care management entity, to establishing eligibility, to applying for services, to getting enrolled in services, that whole experience and everything in between is what we refer to as our front door process. And one very key feature in that front door process is information. It's always been really important for us to make sure that folks that are seeking our services make informed choices so that they know what the process is, they know what the eligibility requirements are, they know who to contact if they need help, but they also know what the service options are and what's available to them, and that they have choices of providers, they have choices of care management entities. So one of the ways that we've always accomplished that since the front door started about 10 years ago is we had information sessions. And these were really great sessions, but they were in person prior to COVID. So there were like these sessions that would be like 1 to 2 hours, depending on where you lived and how many people showed up to the sessions and how populated your area was, where we would teach folks about our services and what are your next steps? What do you need to do to access services? And this was always a requirement in the front door experience. We would hand out certificates at the end of these in-person sessions and say to folks, hold on to this certificate because you're going to need to prove that you went through this and you got your information before we can do the final steps in the front door process for you. Well, so COVID comes along. Put an end to in-person sessions. And we never really went back. So we moved to a webinar or telephone conference with individuals and families, depending on what was best for them. But most folks, we had them go to webinars, and we moved to a statewide model where we posted webinar registration on our website. Folks would find a date and time that worked for them. They'd click on that, they'd register for the event. At the time of the event that they would attend and view. And these sessions were usually around about an hour. So all this time, we have been collecting surveys all these years from individuals, folks that attended these sessions, whether in person or online. And we collect thousands and thousands of surveys, and we read every one. And we started identifying some very key themes. And it all really speaks to this concept of administrative burden and reducing it. Because people, like, for one, were like, can we do this online? It's a little too much for me to have to travel. I have a young child who I'm seeking eligibility for. There's a lot going on. It's really hard for me to take time out of my day to go to an in-person session. And even the webinars, we heard from folks, there's not enough sessions to really fit with my calendar and my busy schedule. I need help with registration. I'm having challenges with that, those types of things, and it's sort of burdens for folks. And we did hear so many times, can you put this online so we can just access it anytime? And also we would hear that there's too much information. I mean, to sit in a 1 to 2 hour session to talk about all the services OPW might provide is a lot. We are a huge service system. And we serve adults and children, people of all ages. So we would hear from folks like, can you break this up a little bit into meaningful segments? I'm already eligible. I don't need to sit through 20 minutes of you explaining to me what the eligibility process is. My kid is 4 years old. We're not interested in employment supports at this time in their life. Those types of things. Break it up so I can view what's relevant to me. So we heard all these, and it was also simplify the language. It's a little too much. It's a little too complicated. So that all led to what we have today, and that's our front door videos. And we launched those in February 1st of this year. So they're only 2 months old out there. And what we've done is we broke it down into 10 different videos. Folks can go online on our website, view anytime they want, view them over and over again, and rewind them and fast forward them if they wish. They're broken into all these different subjects. We have a main video. It's introducing folks to OPWD. We get into specifics like eligibility, if you're interested in that, employment services, self-direction, funding, these types of things. So we leave it to the person to decide what is it that they really are most interested in knowing and what's going to be most helpful for them. Each video they all average to be about 5 minutes long. So we have 10 videos with a total running time, if you sat and watched each one, of 49 minutes total. We currently have them available on the website in English, Spanish, and simplified Chinese. Those are the 3 most spoken languages in New York at this time. We're working on the rest of the top 12 non-English languages that are spoken in New York State. But in the meantime, if people need this information in another language than those top three, they work with our local front door team to get interpretation services for that section. So we make sure nobody's left behind there. So these were really born out of a lot of collaboration, years and years of surveys received from individuals, families, even professionals, like we care managers, even OPWD staff would go to these sessions to learn about it, and just the curious public. And based on all that feedback, we've ended up here, but we've also, it was really great because we were working through a grant that we had received from the New York State Council on Developmental Disabilities. And at this time, the grant was focusing on accessibility for non-English speaking communities. And they focused on two communities in particular, Chinese speaking individuals and Spanish speaking individuals in New York State. And in looking at OPWD's materials and outreach and really looking at like the cultural and like linguistic authenticity of our communication with these communications. It's one thing to translate something into another language. It's another to make sure that the person receiving it on the other end, that it makes sense to them, that it is linguistically accurate and culturally accurate for the person receiving it. So at that time, that group, they had two community-based organizations representing Spanish-speaking and Chinese-speaking New Yorkers who looked at all of our materials, including the information sessions, and said, hey, we got some really good ideas on how things can improve. And they really lined up with the route that they were heading. So we partnered with these groups in developing these videos. And those groups did our voiceovers. They rewrote some of the scripts to make sure that it would make sense to speakers in the other languages. And we also, we partnered with two minority and women-owned businesses as the vendors and the contractors to actually create the videos themselves. So it was a highly collaborative project. We're really, really proud of it. We've already in the past 2 months, we've had over 5,000 views, at least of the initial overview video number 1, we call it. We've gotten over 400 surveys. And largely like really, really positive, really, really great to read. But the surveys also, like, we asked for how can it improve, of course, because that's what got us here in the first place. So we're already getting like some really good and thoughtful feedback about, okay, the next round, what is that going to look like and how can we improve it? So like in putting all this in the context of today's subject, in terms of reducing burden, like one, it's obvious, like, folks don't have to travel to sessions. They don't have to schedule and register for sessions. They don't have to be there at a certain time. I mean, that's a huge burden off of folks to cut things out for their busy schedule. And then dealing with the technology, like sometimes it was really bad. Like, things would shut down as people were trying to log into the WebEx, and we would have hundreds of people in these WebExes. We gave them every week, like those types of things are sort of gone. It's also like, I think of like burden of information. Again, we've like reduced that. We've put it down to more of a snack size. Go pick what is going to work for you. We've also reduced the burden of people having to prove that they've attended these sessions. Back in the day when we first started, we had those certificates, and it was like people had to have their certificates. And if they didn't, they were afraid they weren't going to get services. And then we would get called up and be like, can you prove that so-and-so was there? I was there. This is what you said. I heard, all of that's gone, right? So we leave it to the customer to say, look, we want to make this as beneficial to you as possible. Here it is. Avail yourself of it. You're saying that it's a required step in this whole experience because it's only going to benefit you, but I'm not going to independently verify and ask for proof that you actually viewed these videos. So we've reduced that as well. And it's been a relief of burden on our teams as well, who are giving these sessions and who are tracking all of these things all the time. So why don't we, at this point, I think Rachel has queued up, we're going to share with you a portion of one of the videos. It's our main video introducing folks to OPWDD. So if we could share that, let's go ahead. And I'll also put a direct link to the videos into the chat.
Hello, and welcome to the New York State Office for People with Developmental Disabilities, also known as OPWDD. OPWDD is the agency responsible for providing services for people with developmental disabilities. Services are provided directly by OPWDD or through not-for-profit service provider agencies. OPWDD has 5 regional offices across the state that determine your eligibility for services and help enroll you in services. Which regional office you work with depends on where you live. To receive services, you must meet eligibility requirements through OPWDD's front door process. Each regional office has a front door team that establishes your eligibility for OPWDD services and determines your need for support. The front door team will guide you through the steps necessary to receive the supports and services that are appropriate to meet your needs. First, you make initial contact with OPWDD by calling 1-866-946-9733, or for New York Relay Service, dial 711. Make sure to let the operator know what county you live in and that you would like to apply for services. Interpretation and translation services are available in any language upon request. Next, your eligibility to receive services will be determined based on review of your application and other supporting information. Once eligible, you will take part in an assessment to identify your strengths, needs, and preferences. Then, you will make a plan for the services you need to meet your goals. You will then make a request for services to OPWDD. Once OPWDD approves services that have been requested, you access services by choosing provider agencies who will begin to provide you the services you want. You will not go through the front door process alone. You will work with a care management provider to assist you with each step, and your front door facilitator is available to guide you through the process.
Thank you for that. So that's a little teaser. I would encourage folks, if you're interested, to go watch the full video or the other videos, to please do and share them with others that you think may benefit from it. And please feel free to complete a survey that's right there on the page. So I think that'll about do it for me. And thank you very much for inviting me and allowing me to be part of your day.
Great. Thank you so much. And thank you to all 3 of our panelists. We are now starting the Q&A. I generally like to start the Q&A by asking the panelists if they have questions for each other. But given that we're a little stretched on time, I want to jump right into a question and a topic that has shown up in the chat that I think is really worth talking about. It's specifically about self-direction as an option at OPWDD, but I kind of want to open it up to a larger discussion, which is we talk a lot about how successful New York is in managing and helping families with members who have disabilities navigate the system. And compared to most other states, that is absolutely true. We have one of the most holistic, expansive systems with a million different options. One of the issues with having a million different options is it is incredibly difficult to navigate. And I think self-direction in particular has that sort of dual edge of a sword. One, having a lot of different options for creating autonomy and the system that works for you also means there are a lot more hoops to jump through when you are building that idea. So I want to open up the question to how do we manage those 2 things simultaneously? How do we create a system that has the right options for the right people, where everyone knows what their options are, where the services get delivered where they need to go, that is also easy enough to navigate for the people with disabilities and for their families themselves, what are the concerns? What are the options? And this is open to everyone, but I know, Jennifer, you would like to start.
Yeah, sure. Thanks, Leigh. I think it's a great question. And I just want to reiterate that this webinar is not specific to OPWDD services and how, all the getting in the weeds of the services. This really is meant to be a bigger overview of administrative burden in general for public health systems. And we're using OPWDD with the front door as an example to show how you can use communication strategies to make improvements. We all know that all systems are very complex. I did want to share that, my son is in self-direction. And so we have been in self-direction for a few years now. And, it's truly that when you have more autonomy, it also puts a little bit more of a burden on the users of the system. But at the same time, what I have learned is that there are a few things that can really help that. One is, there is a little bit of a learning curve at the start, but once you start to understand the way it works and different elements of it, it becomes easier over time. And that's true of any system. It's true of, when kids go off to college and start college, there's always learning curves whenever you're using new services or systems. I also want to say that the way that self-direction works here in New York, we use every person in self-direction has a care manager and a broker, it's called. So they have a team of support people. And one of the things to understand is that those people come from different agencies around the state. And who your care manager is and who your broker is really plays a very significant role in your ability to navigate self-direction, either more or less easily, I'll say. And, so for instance, we have an excellent broker, and it's just great. Like, the support that she gives us really makes it very easy for me to figure out what I need to do. And so if you go back to what are the health communication strategies I talked about, one of them had to do with training staff and educating staff. And so that's an example of how we can really use a strategy to help ensure that the people working on the implementation part of that policy and that system can really provide a lot of supports to families. It's also important to understand that with any service, whether you're accessing the healthcare system or Medicaid or, SNAP or OPWDD, things also change. When your child leaves the school system or gets to a certain age, there's going to be changes in what they qualify for. And so it's really about also understanding new things as you go through the process. And you may need to access a new system. Like now we're accessing services through vocational rehab through Access VR in the state of New York. And, so each time it's just about trying to figure out that system. And it is great to have the autonomy, but yes, it does increase burden in some ways, but then also reduces it in others, especially if you have, developed the right supports in place, which is the goal eventually of what we're trying to talk about here today.
We have another question that I think is a really good follow-up, and I think they're going to work together in this conversation. It's specifically about how children who want to enroll in limited liability respite can't have care management and the waiver system in general. But I think more of the question is, and what our two viewers have experienced in interacting with the system themselves, is they have encountered things they think are clear problems that should be remedied and are placing an unnecessary burden on families. How can we have the communication pathways move in both directions? Are there systems where participants and users of these services can provide feedback to providers, not just OPWDD, but can provide feedback so that there's a conversation and there is general improvement in reducing these burdens, specifically these administrative burdens on families? What would you recommend both to those families and to providers to create a system for that feedback? This is open to everyone.
I mean, I can give some general, I'd love to hear from Eric on this, but I can just, give some general insights from theory, I guess, about administrative burden. I think some of this literature I mentioned comes out of behavioral economics as well. And, one of the classic examples in behavioral economics is this idea that you should make the default option you should have an opt-in option as opposed to an opt-out, and that you should make it welfare enhancing. So kind of what would benefit the average person. Or the median person. So the example that's always given is like a retirement plan. If you make people opt into it, studies found that people just weren't signing up for retirement plans. And just by making it, opt out instead of opt in, like you immediately increased enrollment, but also have the default be the most welfare enhancing for the average person. So the one that most people would choose if they really understood what the choices were. And choice can be overwhelming. So when you have too many choices, like trying to just push people towards the one that is probably going to be the best one for them could be a way. So I'll just put that out there as I have no idea if that applies in this case. I'm just, theoretically, those are some things people could do.
So more direct, as far as OPWD is concerned, just reading the comments in the chat, and this is feedback I know that we've received before on both topics. And Jennifer, I'm really glad that you're here today to express your own personal views of it, because certainly self-direction is complicated, and does bring on additional burden as far as managing budget, but there are supports to help you with that. So, both comments as I'm reading them now are, again, have heard before. Now, as far as having that conversation with OPWDDs and rulemakers, I mean, there are a number of councils, there are family and parent representatives that meet with OPWD with our commissioner and our other executive deputy commissioners on a regular basis. The typical person's not involved in one of those groups. So there's also, we have an info line, and we have an ability, if you go online, to email the commissioner's correspondence unit on concerns like that. And we receive that sort of input through those means on a regular basis. So as far as these comments that I've received today, I will be bringing those back to those in our organization that would be, the best ears to hear that. But also would encourage folks to go on the website and see, how to submit comments and concerns through the commissioner's correspondence. And I think that's one way to do that. But I do know that, and I'm not in these groups and meetings myself, but I do know that our executive deputy commissioners and the commissioner do meet regularly with parent and family groups to get that sort of input. They also meet with provider association representatives. We also meet all the time with care management entity representatives as well. So there's a lot of avenues, I feel, for that communication and advocacy and concern raising.
And these are questions we got very similar questions in our last 4 webinars in our in-person conference on the benefits, disincentives for employment, because these are incredibly difficult systems to navigate, and there are different pieces that create friction for different folks. And this isn't a topic that has been studied to the extent it probably deserves. So I know we're slightly over time, but I want to give everyone just the opportunity. Where do we go from here? What kinds of research would be the most beneficial in understanding and reducing administrative burden for this population going forward?
Ash, do you want me to start, Leigh?
Go ahead.
I did. So I accidentally skipped over my community slide in my talk, and I did want to just point out that one of the other avenues around communication is advocacy around media campaigns to promote services or clarify information, and also just thinking about information access in general in someone's community. And I think that in terms of future research and work we can do, there are so many experiences that we still need to understand how, we just were talking about, people experience these systems very differently for a variety of reasons. And so we need to better understand people's experiences in all of our public health systems. And then we need to think about how can we address those experiences through different strategies, including the ones we can pull from health communication. And I can tell you, having prepared for this webinar, I was really disappointed to see that there's not much out there around health communication strategies and administrative burden. So that is an area I'm hoping to continue working in. So anyone who's on the webinar, I would love to hear any thoughts you have about where I should go next with my research. Thank you.
I mean, I'll just add that I love the work that Jennifer is doing around looking at these websites, and I also love this applied approach of, you know, working collaboratively with state agencies to some of the best work that I've seen are doing actual experimental designs where you change up the application and you see, does that improve things? But I think also just getting the feedback from people and then implementing those changes, which is already sounds like there's a process for that happening. I think that's really where it's at, this sort of action-based and community engaged research approach.
Well, I would like to thank all three of our panelists, and I would like to thank our audience for providing such good questions. I was afraid I would have to come up with a bunch of fake questions myself. It's always wonderful to have such an engaged viewership. As a reminder, this is being recorded and it will be available to share, and it is Public Health Week. So please continue to engage in all of the exciting work that the School of Public Health is doing at Albany and the rest of the wonderful events that are happening this week and in general. Thank you so much and enjoy the rest of your afternoon.